When I first started working in the Dominican Republic, we had 15 medical teams a year that would come in and work with us. We now have over 50, and probably this next year will be close to 60. So in the last 10 years, it's been a huge increase in the number of teams that have been coming in. When we go out into a mobile medical clinic, we offer healthcare services, deworming. We offer family planning. We have a malnutrition program that gives deworming medication and vitamins to children between the ages of 1 and 5. And we run a day clinic. We also offer dental care while we're out there. And the day clinics, we start out by loading a big yellow school bus full of medicines and personnel, your translators, the supplies that we're going to need for a medical clinic. And we load up and drive out to one of these villages approximately in 45 minutes to an hour away. And when we get there, we set up in either a church or a school. And sometimes there isn't a building big enough to hold all of us. So we'll set up a tarp or a tent. We'll work under one of those. We'll work under trees sometimes, the place that we can find that's the coolest for all of us, and that we can see the most patients in, that we can have some control over who's coming in and out of those clinics. And when we're out in the villages, we'll see between 75 and 150 people, although there are days that we've seen 300, 350 people in about 6 or 7 hours. It just depends on the size of the village and the location. So we'll do the full medical care, primary medical care during the day, and pack up, and by 3:30, 4 o'clock, we're back on the bus to drive back to La Romana and prepare for the next day. So Monday through Friday, starting January 1st through August 1st, that's my day. And we do medical clinics 6 to 7, 8 hours a day in these different villages. Try to visit each one at least twice a year, although without enough medical teams, we often can only go to some of the villages once. Beyond the medical work that as I was doing the medical work, what I found was that people, because I had the skill set that I did based on my experience in Haiti, in the Dominican Republic, I had trouble, people didn't know what to call me. They knew I was a nurse, but I was doing things that doctors did in the Dominican Republic, and so sometimes people would call me a nurse and sometimes people would call me a doctor. And I realized that I really needed the credentials that would give me proof that I knew what I was doing. Oftentimes when people found out that I was an RN, a bachelor's trained RN, they didn't believe that I really knew what I was talking about. And so my experience really wasn't carrying over as much as I thought it would. Based on that, I decided to make a change and try and find a nurse practitioner program that would be able to work with me while I was working overseas. I found the University of Missouri's nursing program, knew the professors in the pediatric program, and got into that program. The classes were all online. And they talked to me early on in the program because I explained to them that I was the only American in that town that had any medical experience, and there were not medical personnel for me to work under. There were certainly not pediatricians or nurse practitioners. In fact, the nurse practitioners and physician's assistants are not even recognized in the Dominican Republic or in Puerto Rico. And so despite me having the skills to do many things, nobody would recognize me, and I couldn't get a license in the Dominican Republic to do what I was doing. And so I decided to go ahead and do the nurse practitioner mostly for the American staff who were coming in, that they would believe that I knew what I was talking about. And also I had a desire to really make sure that I understood why I was doing what I was doing, that I understood the medicines that I was prescribing really had validation of why I was using certain medicines over others. So I began my nurse practitioner degree online. In probably in 2005, I started the program, 2006. And one of the things that they talked to me about was the fact that I was going to have to do my clinicals under Dominican pediatricians who are trained very differently than American pediatricians. And so when we talked about that, they said, well, what we'll do is we'll make an exception for you and let you train under a pediatrician from the Dominican. But you have to pass all of your exams, pass all of your classes, and pass your national certification exam. If that doesn't happen, then we won't open this program up to others. If it does, then our program will be opened up to others who are living in the same situation you are and don't have access to pediatric professionals to study under. So I knew that I was carrying the weight of trying to have to do very well, and in a very limited environment. I didn't have a medical library to go to. Everything I did had to be online. There were no libraries in the town I lived in, and even in the capital city, which was about 2 hours away, the medical library was only for medical students going to their schools, and they were very limited medical libraries. So I began doing all my studying. I had to order my books and have them shipped, which was incredibly expensive. It was cheaper for me to fly to the States and buy my books and carry them back than it was to actually have my books shipped from the United States. So I did that often every year. I started studying. One of the things I learned in the studies were obviously in the Dominican Republic, because it's a developing country, their electricity doesn't run the same way the U.S. does all the time. There are roaming blackouts. And so very often my internet would go out. And sometimes it would go out for days, and I would not be able to access assignments, and I would have to be calling professors and explaining what was happening. And thankfully I had a really wonderful staff to work with, and they made those exceptions. Sometimes I had to have points marked off of papers, but they were very, very good about working with me. One of the other things that I found out in all the studies was that because Dominican physicians were trained differently, they often didn't treat patients according to a protocol that was published. Where in the United States, we do everything by protocol. We have protocols for vaccines, we have protocols for treatment of otitis media, we have protocols for every disease. And in the Dominican Republic, there wasn't that same protocol. And so each physician that I would work with would do things differently. And so I was learning how to do things according to the Dominicans so that I could get positive evaluations from the professor or from the pediatricians that I was working with. But I also had to learn all of the protocols to be able to pass all of the exams in the U.S. And so it was, there were days I was very frustrated that I had to do both things, that even when I was doing consultations in the Dominican Republic, I wasn't allowed to do all of the things that I needed to do for my paperwork with each class. So I had to go back and find the patients again to do other evaluations. So I finished in 2009. In May of 2009, I graduated with my pediatric nurse practitioner's license, right about the time that everybody was starting to talk about the doctorate of nurse practitioner, which I've still not decided on. At this point, I'm happy with being a nurse practitioner. And I'm able to actually do a lot more education at our hospital. One of the things that I've been asked to do now that I have this degree is to do all of the continuing education for our nursing staff. And so that's some of the projects that I'll be working on when I return in a few weeks. So all 10 years of experience in the batés, in the villages that we work in, really prepared us for what happened in Haiti when the earthquake hit. On January 12th, I'm sure everybody knows, on January 12th, there was an earthquake in Haiti. It lasted 35 seconds. It happened just before 5 o'clock in the afternoon. And there were over 300,000 people that died. And there are still over 1 million people living on the streets in tent camps or just along the streets. And the population of Haiti altogether, just so you can kind of get an idea, is about 10 million people. And it's on the country the size of New Hampshire. The Dominican Republic is twice the size of Haiti. And it only has 8 million people living in it. So you can, the crowding is not as much of an issue in the Dominican Republic, although in large cities it is. But in Haiti, they've done so much deforestation that folks are really forced to live in big cities. And so Port-au-Prince itself has several million people living there. The majority of the population lives in Port-au-Prince. And so when 1 million people are living on the streets, and most of the buildings in certain areas of the city are completely to the ground, there creates some serious health issues. 5 days after the earthquake, I was asked to lead a team of 100 Dominicans, physicians and nurses, into Haiti. One other American joined our team, a trauma surgeon, but beyond him, every other person who went with us on that trip was a Dominican. And we began starting to solicit American help for medical clinics. We would be working there. And when we first went into Haiti, I honestly was really nervous because I wasn't sure what to expect. I had lived in Haiti for a total of 3 years, and I knew how terrible Haiti was. I knew what the health conditions were like before an earthquake, and I had lived in the northern part of the country where it wasn't as crowded, and vegetation was not as much of an issue as it was in the south. And so I really had no idea what to come into. I can remember when we crossed the border, hundreds of thousands of people were crossing the border to help with relief efforts. And there were trucks everywhere and Red Cross vehicles everywhere, ambulances, and folks just in jumpsuits waiting to go into the country, waiting to catch rides in and do some work in Port-au-Prince. And when you got in there, there were so many vehicles on the road. Everybody had rented cars or brought vehicles over, shipped them over. All these relief agencies were driving around everywhere. And in the midst of that, there were buildings down across the middle of the street, or people still injured. We were still seeing bodies lying along the sides of the streets as we got there. It was it was as bad as I ever remember Haiti, plus just with the devastation of the earthquake, now people had even more limited access to resources. Hospitals were brought down, clinics were brought down, medical and nursing staff were killed. And so there was this limited amount of limited resource available for patients in Haiti at the time. And then when the other foreign countries started coming in with their relief works, many of them didn't speak Creole. Many of them didn't speak French, and so they're going in and trying to do consultations without even the language abilities, or finding translators within the country to try and work with them. So it was kind of chaotic the first couple of weeks that we were in there, but we were able to visit tent camps, and most of the camps would have signs outside of them that would say the name of their tent camp and a sign that says, "We need help," and sometimes in several languages. They would do it in Spanish and English and French, so that anybody that was coming in would be able to understand. It was really interesting to see how many South Americans, Brazilians, really, lots of Brazilians came in. In fact, the UN, many of the UN forces were Brazilian. And so you found very quickly, too, that the U.S. military and the UN, French sent in over a lot of people with the UN as well, were really running the country at that point. When we crossed the border, there was nobody at the border to take our passports or to stamp them. I made a dozen trips into Haiti since the earthquake, and I don't have one stamp in my passport that says that I was in the country. So it was fairly chaotic through most of those months. When we got into the tent camps, what we found was that most of them were pretty desperate. In the beginning, most people were living under sheets and blankets that they had been able to pull out of their homes. And sometimes even their homes weren't damaged so that they couldn't stay in them, but they were just too afraid to stay in the homes. And so they ended up living in front of their house on the sidewalk or in the driveway of their house, because they were afraid to go into the buildings. Within a week of the first earthquake, there was another earthquake. I don't know, most people don't know about that. But in neither case, neither of them were strong enough to relieve the pressure on the fault line. And geologists say that there is a bigger earthquake still to come, and it could come any day. It will be so much bigger that it'll affect at least the Dominican Republic and potentially Puerto Rico and Cuba as well. The devastation from the next earthquake will be horrifying. So if 300,000 were killed in Port-au-Prince with this earthquake, there's no telling how many people will be killed in the next one. And then again, the relief resources will be different on the next one, because if the Dominican Republic is affected, then they'll have trouble sending people over to help in Haiti. They'll be helping themselves in the Dominican. One of the first things I did just before going over to Haiti was also to visit a hospital in Santo Domingo, where they were bringing out patients following the earthquake. And interestingly enough, if you're not thinking of this at the time, but when you bring out a patient, a trauma patient, you really do just think about getting them the care that they need, and you get them out of the country, but you don't think about they won't have one person who's supporting them. They will have no family members with them. They have nobody to speak for them. And sometimes their traumas are severe enough that they can't speak. They can only moan or groan or cry. And even then, if they can tell you what's wrong, if you don't speak Creole, you can't understand. And so we went to visit a hospital and offered our services as translation. Several translators and myself went over there and did that. And then when we did take the team over of 100, and we found the tent camps, well, we found that most people were really hungry. We still did find wounds, fractures that hadn't been taken care of, hadn't been set yet. We found people that had not had any food since the day of the earthquake. We found people who had not had clean water since the day of the earthquake, and so we were bringing them food and water as well as medical care. We almost always, every week, found a woman who needed help with her pregnancy. Potentially, she had a high blood pressure, preeclampsia, and we needed to help with that. We would find women who had delivered in these tents and had never had any care done to check with those the baby, to find out if the baby was healthy or not, or even if the mother was healthy. And so we were actually doing a lot of the primary follow-up care that most women would have gotten if the country had been running well, had not had the earthquake. What we did find too was that a lot of people would work for about a month. They would come in and out every week, sending people in, and then after about a month or two, most of the teams stopped coming in. The majority of the teams that were there the first month were not there the second and third month. And so we found that many of the tent camps who had initially received some medical care were no longer receiving medical care.